Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. Everyone who is anyone, both the famous and the infamous. From presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I'm proud to introduce you to Dr. Vincent Felitti, whose expertise in untangling complex biopsychosocial problems has benefited his patients for more than 5 decades. Dr. Felitti, it's such a pleasure to talk with you. I've been doing some research on this area, so I find it very fascinating. What made you actually consider a career in healthcare?
Well, in my family, my father, my grandfather, several uncles, and multiple family friends were all physicians. And so I grew up as a little kid with constant exposure to clinical medicine. And I, even when I was 6, I saw it as being important as well as interesting. And that basically was the starting point.
And sir, I see you have some military experience as well. Can you tell me a little bit about that time in your life and how it influenced
Yeah.
your approach to health?
Yeah, in those days, basically any doctor was going to start off by being in the military, and so I was in the early '60s, and it was a very good experience. It got me to seriously consider it as a career, and introduced me to thinking about medical care on a population basis, as well as on the individual basis that I was taught in medical school. And it also taught me how to become comfortable working as part of a very large organization. I enjoyed my time in the Army greatly.
So tell me a little bit about some of the practical experience you gained that makes you such an effective professor, because you're a teacher's teacher.
Well, I started off doing adult infectious disease work as an internist, and enjoyed that very much. And what led to that was interesting. Again, as a little kid, I read a book called Arrowsmith by Sinclair Lewis. It was about a medical student with a big interest in bacteriology. And somehow that activated my interest in bacteriology. And as an adolescent, I read about it. And when I went to college, I took a number of courses in bacteriology, and then went to graduate school in bacteriology. And in medical school, I met some very supportive physicians who were involved in adult infectious disease work. And so that was all supportive. And in my first 10 years at Kaiser Permanente, I did infectious disease work. And then I was asked to start a department of preventive medicine, and that led to major changes, all of which were surprisingly interesting.
Well, sir, I have you here, and we know what's going on in our world with the global pandemic. So there is no way I'm not going to ask you about COVID-19 and where we stand as a country and as a world.
Well, we're not doing terribly well, but if you read about the Spanish influenza epidemic of 1918, which killed, it is estimated, approximately 50 million people worldwide, they did not handle it well then either. I think it's in part because people don't recognize the potential seriousness of it. For instance, on average, every year, in terms of influenza, between 30 and 70,000 Americans die every year of influenza. For many of us, it's an illness where we have a fever and bad muscle aching for 5 or 6 days, and that's the end of it. But for other people, it's a catastrophic illness. Influenza pneumonia is really a very life-threatening kind of problem.
And sir, I have to tell you, I'm a heart disease survivor. And so that puts me in more of the vulnerable population. I've been doing everything that my doctors and the scientists have been recommending social distancing, continuing to wash my hands, and of course, wearing a mask. Um, I think that when you deal in the area of infectious disease, getting everyone on board with a plan of action is probably one of the most important things.
Oh yeah, without question.
Would you say that you now have a specialty within medicine, given all the different things that you've done?
Well, I've spent about 40 years doing preventive medicine.
Okay.
And again, that was a surprise. That had not interested me at the beginning. But then when I was offered the opportunity of setting up a department for the first time of preventive medicine, I saw that as a real opportunity because nobody would really care what I was doing in that field. I mean, preventive medicine is a relatively low prestige field compared to infectious diseases. And that would give me a lot of freedom to test out ideas that I had about how to improve medical practice. And it worked out that way superbly, to levels that I never would have anticipated.
Well, doctor, you may be right. I guess I work in the media. Preventive medicine may be low prestige, but quite frankly, it's the foundation of every single part of medicine
Oh yeah,
to be able to try to prevent
yes,
diseases and illnesses.
yes. And indeed, what we stumbled into there was interesting. Um, I put together a department that one division of which, health appraisal, provided uncommonly comprehensive medical evaluation to over 50,000 adults a year in one setting. It was an extraordinary operation. And soon it became obvious that we needed to create our own prevention programs because the conventional ones often were not very effective. The initial one was obesity. And so in the middle 80s, we started an obesity division using a then new technology of supplemented absolute fasting, which allowed us to take a person's weight down, incredibly, about 300 pounds in 1 year. And we were doing that and thought, well, my God, we've got this problem licked. But then we found that, much to our surprise, patients undergoing massive weight losses, 100, 200, 300 pounds, were often terrified by the experience and fled the program to regain the weight as quickly as possible. And in exploring that, we stumbled into the issue early on, fortunately, of childhood sexual abuse, which, obviously exists, but I had no idea at the level that it exists. All of us have been taught very effectively as children that nice people don't talk about certain things, and my God, surely don't ask questions about them. And so this is a totally obscured area. In the obesity program, this was a remarkably prevalent history. We were treating in the program about 1,500 patients a year. 55% of them acknowledged a history of childhood sexual abuse, typically as the onset of their adult weight gain. And then as we went down that path, we stumbled into all sorts of other abusive childhood experiences and growing up in massively dysfunctional households. I presented this in Atlanta at a national meeting in 1990, what we were finding. And there was a dinner meeting for speakers afterwards, and seated next to me was a senior scientist from the CDC. And he said, look, if what you're saying is true, it's got enormous importance for the country as well as the practice of medicine. But what we need to convince people of this is a major epidemiologic study with thousands of people in it. And that was really the beginning of the 20-year ACE study involving we asked 26,000 people if they would help us coming through for comprehensive medical evaluation. 17,500 agreed. And so we then followed them for the next 20 years. And that was the basis of a study that has attracted international attention now.
I have to tell you, sir, that is so fascinating to me. I think you know my background as a former New York City prosecutor, and of course, I prosecuted sexual abuse and rape cases. And one thing that I did find in talking to some of the psychologists is that the weight gain occurred with women victims specifically because they were trying to hide themselves
Absolutely. I
within
mean,
the weight.
that was incredibly common.
I am just fascinated with this work, very fascinated. Sir, can you tell us a little bit more about your work with the Permanente Journal? I know that that is something that had a significant role for you.
It has. For some reason, as a little kid, I was always interested in writing. And, even when I was 6, 8 years old, I was interested in writing. When I was in high school, I was editor of the high school newspaper. In college, and then in medical school, I had some research work that I had done that ended up being published. Supporting my activity in all of this was the realization that medical publications were a very important way of disseminating knowledge about how to improve medical practice.
Doctor, what's the most important piece of advice you think you would give anyone seeking a career in medicine?
Well, I suppose first would be to figure out whether you're really interested in clinical medicine or in medical research. Those are two very different fields. And if you're interested in clinical medicine, then you have to make a decision. Are you going to go into solo practice? Are you going to grow into a small group of 2 or 3 physicians sharing an office, or are you going to join a large medical organization?
It sounds like you're also saying to anyone who is interested in going into the medical field, be open to opportunities to grow and to expand upon what even your own initial dreams and aspirations
Yeah.
are.
Yes. Yes. And then I think another choice that needs to be made early is, are you going to practice in a purely biomedical mode or in a biopsychosocial mode? In other words, will you deal only responding to the manifest symptomatology, or will you look at underlying causes that may have been decades ago in life experiences that typically are totally unrecognized?
I was just sharing with you that as a heart disease survivor, I'm the national volunteer for the American Heart Association, and I know that patient history really and truly helped save my life and get the right diagnosis with my physicians. And so I am grateful for your advocacy for patients, patient care, and for preventive medicine. So thank you so very much for your time today.
You're more than welcome. Thank you.